Hi everyone, my name is Samantha Rushman and I will be presenting my scholarly research project on COVID-19 infection among patients with periodontal disease. Due to the recent coronavirus pandemic and previous infectious disease outbreaks, including Ebola virus, Zika virus, Middle East respiratory syndrome, and a multitude of others, RNs need to be prepared to handle the influx of potentially infectious patients. Infectious disease preparedness and education are important in the healthcare setting due to the relatively easy spread of infectious diseases or contagious respiratory viruses and the pace at which outbreaks occur. In addition to the ease and pace of spread, the ramifications posed to individuals with chronic inflammatory conditions, such as periodontal disease, can prove to be significant, resulting in serious complications and/or death. Periodontal disease is a chronic inflammatory oral disease that affects teeth and their surrounding structures. This condition also has systemic inflammatory effects, which have been found to be associated with multiple chronic conditions, including cardiovascular diseases, diabetes, lung disorders, and even cancer. Periodontal disease is one of the most prevalent conditions across the globe and can have damaging outcomes for individuals diagnosed with coronavirus. It is no secret that oral health and hygiene have been insufficient in long-term care facilities and hospitalized patients. For example, 1 in 10 nursing home deaths attributed to pneumonia could have been prevented if an oral health hygiene protocol was in place. The significance of infectious disease prevention and management among individuals with periodontitis and/or periodontal disease impacts patients, the field of nursing, including advanced practice registered nurses, or APRNs, and healthcare at large. Each RN and APRN play an intricate role in infectious disease prevention, identification, and management, as well as caring for patients with a diagnosis of periodontitis and/or periodontal disease. Currently, a gap in care exists between infection prevention education and healthcare systems and periodontal surgical clinics. Additionally, patients' history of periodontal disease is typically ignored in healthcare settings, especially when they are being treated or admitted for another condition not related to the oral cavity. More research is necessary to bridge this gap and recognize the role the periodontal disease plays in patients that are at risk of contracting or do contract an infectious disease. The research question for this project is, among patients with a diagnosis of periodontal disease, does education on COVID-19 infection prevention strategies, i.e. hand hygiene, mask wearing, and social distancing, decrease the rate of patients testing positive for COVID-19 when compared with patients that do not receive education on COVID-19 infection prevention strategies? The purpose of this quality improvement project was to assess the impact of infection prevention education on the rates of patients with a previous diagnosis of periodontitis or periodontal disease that tested positive for coronavirus. The independent variable was generally defined as infection prevention strategies such as hand washing, mask wearing, and social distancing that were provided to participants through an educational intervention performed by the researcher. The dependent variable was defined as the rate of patients that tested positive for COVID-19 through self-report. The aim was to determine if infection prevention strategies prevent patients with a diagnosis of periodontitis and/or periodontal disease from contracting COVID-19. In contrast, patients that did not receive infection prevention education may have had higher rates of COVID-19 infection. The concept was to find supporting evidence that infection prevention education would ideally reduce patients' risk for hospitalization and/or death, while also attempting to gain insight into patients' current perceived use of infection prevention strategies and how it related to contracting COVID-19 or if deficiencies were present. Here are the inclusion and exclusion criteria for participants. Individuals with a previous diagnosis of COVID-19 were excluded. As you can see, there is no specific inclusion or exclusion criteria for people that received the COVID-19 vaccine. More on that later. The organization that sponsored the scholarly research project was located in the Midwest region of the United States. The facility employs one periodontal surgeon who provides care for over 5,000 patients. Periodontal services offered at this clinic include gum health and preventative care, periodontal disease maintenance, dental implants, and others. There was a total of 100 participants in the study, all of which had a previous diagnosis of periodontitis and/or periodontal disease and did not have a previous diagnosis of COVID-19 infection. 50 participants were in the group that received infection prevention education, consisting of hand hygiene, mask wearing, and social distancing. 50 participants were in the group that did not receive infection prevention education. Participants were assigned to a group based on the even or odd date of their periodontal appointment. The survey questionnaire and education materials were created specifically for this research project through utilization of evidence-based and up-to-date guidelines. Here is an example of the questionnaire that every participant completed. As you can see, at the top of the questionnaire is a demographic information, which includes the participant's age, gender, which consisted of male, female, or other, email address, and occupation. Now, the first question on the questionnaire, have you previously been diagnosed with COVID-19, was very important for the participant to answer because that helped the researcher, myself, determine if the participant was eligible to participate in this research study. Questions 2 and 3 were related to whether the participant had received the COVID-19 vaccine, and if not, if they were planning to get the vaccination within the next 30 days. Questions 4 through 6 were part of the responses in which patients displayed their perceived utilization of those infection prevention strategies. Answers ranged from always, most of the time, some of the time, and never. Regarding hand hygiene, the answers to how often the patient washed their hands were constantly, frequently, occasionally, or rarely. The final question, question 7, asked if the participant had received their influenza vaccine in the previous flu season. Since influenza is also an infectious disease, this data could help us understand whether the participant might want to receive the COVID vaccine based on the response to this question. Every participant received a follow-up survey via Qualtrics 30 days after the date they signed on the consent form. The questions that were asked were, have you tested positive for COVID-19, or have you received a COVID-19 vaccine in the past 30 days? All responses were sent back through Qualtrics to maintain anonymity and were recorded on the data collection sheet. Here is a visual display of the results, and more specifically, the patient demographics. So, 51% of participants identified as male and 49% identified as female. There were no participants in this study who identified as other. Participants ranged in age from 19 to 65 years old. 15% were between 19 and 29 years old. 19% were between 30 and 39 years old. 26 fell in the category of people aged 40 to 49 years. 22% were between 50 and 59, and the remaining 18% were between 60 and 65 years old. The nominal data collected was analyzed using a phi correlation with an effect size of 0.05. Here is a graph of the self-report of COVID-19 infection 30 days after the date the participant signed the consent form, or 30 days post-appointment. The phi correlation coefficient was calculated to determine if there is an association between infection prevention education and a decreased rate of COVID-19 infection among patients with periodontitis and/or periodontal disease, as well as the strength of that relationship. Based on the results of the study, patients with periodontal disease that receive infection prevention education, more notably hand hygiene, mask wearing, and social distancing, are less likely to test positive for COVID-19 than patients that do not receive infection prevention education. A significant difference was found between infection prevention education and decreased rates of COVID-19 infection, with the standard deviation being -0.273 with statistical significance at 0.006. This means that infection prevention education, more specifically hand hygiene, mask wearing, and social distancing, are effective measures in decreasing a patient's risk for contracting COVID-19, experiencing serious complications, or even dying. The findings for the scholarly research project indicate that a relationship does exist between infection prevention education and decreased rates of COVID-19 infection among patients with periodontitis and/or periodontal disease. This relationship means that patients with periodontal disease can benefit from receiving education on infection prevention strategies, including hand hygiene, mask wearing, and social distancing, that will later decrease their likelihood of testing positive for COVID-19. There were some limitations noted during this study. Local and state guidelines and mandates related to COVID-19 changed continuously throughout 2020 and 2021. Various treatment options became available during the data collection period, which occurred from May 3rd to July 30th, 2021, including monoclonal antibody therapy and several different COVID-19 vaccines, more notably the Pfizer, Moderna, and Johnson & Johnson vaccinations. A convenient sample and survey tool were utilized, which could have added to bias and reliability of the results. And results cannot be generalized to a larger population until the study is repeated with similar findings. Some barriers were present as well. Through the course of the COVID-19 pandemic, outpatient clinics and other offices deemed non-essential were closed for the majority of 2020. Safety guidelines and recommendations for outpatient clinics changed frequently and rapidly. Vaccine availability was originally in limited supply, but later became widely available. The design of the study did not factor in the vaccine as an infection prevention intervention. Like a lot of you, the pandemic did affect the sample size and timeline for completing the study. It took several months to get the intended sample size of 100 participants, which in normal circumstances or pre-COVID conditions could have been completed in no more than 2 weeks. If this study were to be repeated during, again, the normal or pre-COVID conditions, more than 100 participants could easily be obtained in that same timeline, which would encourage generalizability and strengthen the findings. Ongoing research and updating of infection prevention education should be undertaken by healthcare facilities on an annual basis to ensure evidence-based practices are being utilized to improve quality and safety measures for patients. Implications for future practice. Nurses should provide infection prevention education to decrease rates of patients that contract an infectious disease. Effective education and utilization of infection prevention strategies can decrease transmission to other patients. Hand hygiene, mask wearing, and social distancing can easily be taught to nearly every patient in a variety of settings. Education materials should be updated regularly with evidence-based guidelines and shared with nurses, patients, and other healthcare workers on an ongoing basis. There is a need to develop a universal protocol for infection prevention education among patients with periodontal disease. Also, an effective evaluation tool needs to be developed to assess a patient's risk for complications after contracting an infectious disease. This tool could be utilized by nursing staff to determine if risk factors are present, the need for intervention, and whether or not the intervention needs to be implemented. Infection prevention strategies should be taught to hospitalized patients upon discharge, patients in the emergency department either being discharged or admitted to the hospital, and in outpatient settings. Outpatient clinics, more specifically, should include primary care and specialty offices, as well as patients in dental practices or periodontal surgical clinics. Teaching patients these strategies to decrease the risk for serious complications associated with infectious diseases is very important and can easily be taught to all patients in most settings. Now, for implications for future research, COVID-19 is a relatively new virus and limited research exists on its virulence and transmissibility. Its precise etiology is still unknown. We need a better understanding of the interaction of COVID-19 on periodontal disease and how that affects patient outcomes. Generally speaking, more research on periodontal disease needs to be done, in addition to how it interacts with other infectious diseases and chronic conditions, such as cardiovascular disease, COPD, asthma, diabetes, etc. To sustain results, the study needs to be replicated to establish reliability, validity, and generalizability. More research is needed to identify the relationship between infection prevention strategies and effectiveness of vaccination on rates of COVID-19 infection. It will be interesting to see if and how the COVID vaccine changes as new strains emerge. Additionally, more research needs to be included on the specificity of the vaccinations and how effective they are at decreasing rates of COVID-19 infection. The reason a vaccination was not initially included in the study was because it was determined that there would be a vaccination shortage. In real time, as we continued to gain access to vaccines, there happened to be far more vaccinations than we could administer, and inadvertently, we ended up wasting doses. If this study were to be repeated in the future, the availability and efficacy of the vaccine should also be included in the results. Here are the references for this presentation. I very much appreciate you watching and listening. Please reach out if you have any questions. Thank you.